today we're looking at just one part of your Medicare coverage, and that's Part D, or the prescription drug plan. We know Medicare is complicated with the whole alphabet soup of parts A and B and your Medigap policies. Today we're just looking at Part D because there's a few things you can do and check each year to make sure you're not overpaying on your prescription drug plan. And so to start, why are we doing this right now? Well, it's open enrollment season for your Medicare from now through December 7th. And so any changes you enact during this open enrollment period will become effective January 1st. So you're still on your current plan that you selected last year through the end of the year. And if it's best just to keep the plan you're currently in, you don't have anything to do. Early this month, you probably received a change notice from Medicare about what's changing in your plan. So you should have an idea on, what your new premium is if you stick with your current plan and if there are any coverage changes. And so if you know that what you have will work with you next year, you don't need to go online to do anything. You'll automatically be enrolled. This webinar is for anyone who currently has a Medicare Part D plan, and it's especially important for those who have had some changes in their prescription drugs during the last year. But even if your Medicare Part D plan sent you a notice saying, nothing was changing, even if there were no changes to your prescription drugs that you take, this is still something important to do. And that's because these plans change every year. Insurance companies work out new deals with drug makers all the time. The costs change, coverage changes, the co-pays change. And so we've seen with a few clients, they've been able to save even up to a couple $100 per year, even without factoring in any changes in their prescriptions, but just because some of these plans changed. And later in this, Jesse will walk through the whole process of comparing the prices on all these Part D plans. It can take as little as 10 or 15 minutes to run through this. And so if that 10 or 15 minutes can save you a couple $100, it's not a bad return. And lastly, even if you don't take any prescriptions right now, this can still be a good thing to do if you're not enrolled. Some of the more basic Part D plans cost around $12 or $15 per month. And that can be there to protect you in case you need to start any prescriptions halfway during the year. And obviously a lot of prescriptions can be very expensive without insurance. And so that $15 a month can really provide an important safety net in case there's a big change to your health in the meantime. I'm going to turn it over to Jesse in just a minute here, but first we wanted to explain a few of the terms you'll see as we go through the Medicare website. And a few of these terms you've heard or read about before, I'm sure, but just to make sure we're all on the same page here. First are some basic ones you're familiar with from insurance even before you were on Medicare. Every Part D plan will have a deductible that's shown. This is what you pay every month for the insurance, but it does not include any drug costs. And so this premium is the first thing you'll see, the first detail you'll see listed about any of these plans. But by the time you start adding in the cost of a few prescriptions, this premium's probably not going to be the most important part of your Part D plan. Instead, your drug costs will be, and as we'll see in a minute, don't get too fixated about just this premium cost, because it might not be the best thing to look at. And next, every plan has a deductible. However, all Medicare Part D plans must follow rules set forward by Medicare. So deductibles on Part D plan are pretty standard and don't vary a ton. For 2021, the maximum deductible a plan can charge is $445. They can have a lower deductible, but you're not going to find a plan with a higher deductible than $445. And then two of the more complicated parts about Medicare are the coverage gap and then IRMA, or the added charge based on your income. And so first we wanted to look at the coverage gap here, which is also known as the Medicare donut hole. And First, I'll say this used to be a much larger issue than it is today, and that's maybe why you still kind of hear it talked about a lot, seen a lot written about it. 6 or 7 years ago, this coverage gap, or this, this hole in your coverage, was an area in Medicare Part D that led people to paying a lot out of pocket for their prescriptions at kind of the certain times. It was a problem for a lot of people who had a few very high cost prescriptions. They've done some work to close this. It's still a thing today, but it doesn't have quite as big of an impact as it did, maybe 5 years ago or so. But this donut hole is just one of 4 phases of coverage in your Medicare Part D plan. Every Part D plan has 4 phases, but exactly how much you'll pay in each phase will depend a little bit on your specific plan, and then also the prescription drugs that you're on. But in general, the first phase is your deductible phase. Here you're paying for your drug costs until your deductible is hit. For those that have, 0 deductible health plan, this phase doesn't really exist. For others, it's going to be up to that $445 limit. Phase 2 is what's called this initial coverage phase. Here you're paying a pretty set copay or fixed cost for your prescriptions. The exact amount here is going to depend on the drugs you take and how expensive they are and what tier they are in the system. And this will clearly be shown on your plan documents, as Jesse's about to show you in a minute. Then once you and the insurance company spend a total of $4,130 on drugs, you enter this infamous coverage gap, or the donut hole. And in this phase, you pay 25% of your prescription drug costs. And again, this 25% is what's changed over time. I think 7 years ago, it was as high as 50 or 60%. And so this is kind of the narrowing of the gap, and why it used to be a big deal. It's still a change in how much you pay, but it's not as steep as it has been in the past. But so if you're on some very expensive drugs, this can still be a pretty steep jump, as 25% of the cost of some drugs can still be a lot of money. But this phase doesn't last long if you have these high cost prescriptions, because once you and the insurance company spend a total of $6,550, you get out of this donut hole and you enter the final phase, what's called the catastrophic coverage phase. And from here on, you'll pay 5% of your drug costs, or a very low copay, a copay between $3 and $10, depending on the drug. And so now this sounds complicated, and especially if you start to try to do all this math in your head. But the nice thing about the Medicare website, and when you're shopping online for these Part D plans, is that you'll be shown exactly how much you will pay for each prescription you will take, and how that translates into how much you'll pay each month or each quarter as you're refilling these prescriptions. And so Jesse will show you that in just a minute. One last thing that can be an added cost for a lot of people's Medicare is IRMA. And so this is Medicare's income-related monthly adjustment amount. This impacts your Part B premiums, but also your Part D premiums as well. There's 2 images here. The left one is Part B premiums based on income, and the right is Part D. So you can see the first bracket is for income above $174,000 for a married couple. And if they get above that limit, above $174,000, just for example, their Part B premium would rise from $144 a month to $202 a month. So about $60 a month each. And so for a married couple, that'd be an increase of about $120 a month. Those same income limits also apply to Part D, to your drug plan. It's a little bit less of a penalty or an added cost. Just for example, someone just above $174,000, you would add $12.20 to your monthly Part D premium. And so we've talked a lot about this in terms of we've talked a lot about IRMA in terms of, tax planning and maybe Roth conversions and some other topics with a lot of you here. So we won't rehash everything here. But it's somewhat common for some of our clients who have just retired and started Medicare, those who have received a severance offer, or maybe who have had large purchases for 1 year in retirement where those large IRA withdrawals have kind of bumped up their income, maybe buying a house or a car. And so for some of you, just with investment income, we can try to control this with how we use your different investment accounts. We can use a combination of money from your IRAs, your taxable brokerage accounts, or even your Roth IRAs in years where you might be approaching these limits. For those that are reaching these limits because of income or severance pay, there are some things you can do. We have helped a couple clients file an appeal with Medicare that can help lower your payments if you fall under some of their specific guidelines or what meets the criteria to be able to appeal. And so I know a couple of people on this call we're talking with about this right now. And so but if we haven't and this is going to impact you, let us know if we haven't talked about it already, and we'll be sure to make sure we see how we can help you. And so those are the big items with Medicare. Now we're going to get into walking through how this actually looks on Medicare's website and some of the options that you'll see as you go through. And so to start, you'll want to log on to your Medicare.gov website. That link's right on the homepage. When you log in, you'll see your plans and you want to select the option to find 2021 plans. And this is going to be shopping, again, for next year's plans. For right now, all we're showing is, the drug plan Part D, and you'll want to enter your zip code where you are because a lot of plans are just available depending on your zip code. And from here, we'll get into what it actually looks like on the Medicare site. And Jesse will take over. Give this a minute here. And Jesse, did that screen pop up?
Yep, it sure did.
Great.
Well, good afternoon, everyone. So we're going to walk you through the steps specifically to add drugs, to add pharmacies, because that's important because that's going to dictate the estimates of your costs. So, if in the last year you are no longer taking one of your prescription drugs or you've added some, you want to make sure that you're editing that list here so that you get the most accurate costs on the next screens that you'll see in a second. So here, we've just added some different drugs. It gets pretty specific in terms of, the name of the drug, the quantity, and then the frequency, with which you're taking the drugs. So I know it seems like a lot of information, but it's worth your time to add that information. There are links there you can probably see to remove drugs and then also to edit drugs if the quantity or the frequency has changed. To add a drug, you just click on that add a drug button, and then you can type in the name of the drug. And this is kind of slick because it'll auto-populate if it recognizes, which is nice since some of these drug names are impossible to spell and very long. But yeah, you're going to select the drug, the dose, the quantity and frequency, and then click Add to my drug list. And once you've modified that list, then you can click Done Adding Drugs, and on the next screen, it'll show different pharmacies. So where you entered in your zip code, that should auto-populate on this screen, and then it'll find pharmacies near you. We recommend always checking the mail order pharmacy because even if that's not what you're doing now, you can at least see the costs on the next screens to know if that's a more cost-effective option for you. And some people just don't want to do mail order pharmacy, and that's fine, but at least you can kind of have that, if that option is available for your plans. So you'll want to add and you can add up to 5 pharmacies, but we've added 3 here. And it's important to pick your preferred pharmacies because it'll also tell you on these next screens whether or not they're in your network or out of your network for the plans that you're looking at. So after you've selected your pharmacies, you just click done. All right, so here is the anticipated information. So you're gonna get a lot of different options on the results page, which is good. The plans in the upper right-hand corner, it says sort plans by lowest drug and premium cost. You can look at the plan list here in a different way, but this is probably the best way to look at it to start with, because this view, this default view, is going to show you the most comprehensive amounts. And that's how you want to look at it, because you don't want to just look at the premium amounts, because that's actually can be really misleading depending on what drugs you're taking. So you've got just a high-level summary by plan here of what you'll pay in premiums, and then what you'll pay in the yearly drug and premium costs. So that section there, yearly drug and premium costs, is what you want to focus on, because those are going to be your true costs for the year, not just your premiums. So you can scroll down. There's going to be pages of plans here, but if there are certain ones that you want to compare against each other, click that Add to Compare button, and then you'll see it populate in that blue bar at the bottom of the page. And you can compare up to 3 at a time, and then if there were like 6 plans that you wanted to look at, you would just have to do this a couple of times. But once you've selected the plans that you want to look at and compare to each other, click Compare. And then you'll see this nice side-by-side view of the information for each of the plans. And this is a good view because, as you scroll down the page, obviously you're going to see the premium amounts, the deductible amounts, which should be, are probably for most of them, are going to be that $445 maximum deductible. But as you can see in that first column, it's actually 0 for that plan. But again, that could potentially be deceiving. So in terms of like overall costs. So as you can see here in that second table of where it says like 5 out of 5 at the top, that's where you want to look at the total costs by pharmacy for each plan. So these all happen to be pharmacies that are in the networks, but if not, it'll tell you that. It'll have a red X and say out of network, so that's important to take note of. Oh, sorry, that's my dog. Oh, that's the beauty of live webinars. Lizzie, it's okay. So sorry about that, everyone. So you want to look at the cost by pharmacy and by plan for each of these. And then if you scroll down just a little bit more, you can go into the plan details, which we do recommend doing for each one of the plans that you're interested in. So you'll see some of the information you just saw on that last screen. But then you'll want to check out in this first table, you have, so Matt's screen where he showed the donut hole and the different phases of coverage, that's what this section is referring to in this first table. So the initial coverage phase, and I don't know why they use different terminology across the site, but that's going to be your, after you hit that deductible. So that's your initial coverage phase. And then the gap coverage, that's a donut hole phase. Now that we've talked about donuts so much, I actually really want a donut. And then the last one, obviously, is the catastrophic coverage phase where you're paying a lot less, but you've paid quite a bit up to that point. I do want to point out that drop down above the table where there's tier drug costs 4. It is worth looking at the costs for these because especially if you're doing mail order, you can look at costs, yeah, for the 3 month, which can save you quite a bit of money on some of your out of pocket costs. So just a note, feel free to play around with the drop down there. That'll only change the numbers in this first table. And then if you go down, this is where we see, again, the pharmacies that you selected and whether or not they're in or out of network. And then each section below this gives you the cost by pharmacy. So, you know, if there's certain pharmacies that you prefer over the, you know, 2 others that you've entered, make sure you're looking at the detailed costs for this, but it's going to list the costs for each of your drugs in each phase of coverage. So cost after deductible, that's your initial coverage phase. Cost in the coverage gap is the donut hole, and then cost after is the catastrophic phase. And then, yeah, it gives you a further breakdown, you know, monthly costs, which is, you know, can be helpful to see, especially if you're a person who likes to kind of budget out things throughout the year. But you have this information for each pharmacy that you can take a look at. Yep. Mail orders at the bottom, yep. And then it's just summarizing everything that you already know from other screens. But I do want to point out the contact information at the bottom, because this is where you're going to have to, if you don't have the option to enroll online for the plan that you eventually select, then you're going to want to use the phone numbers on this section or visit their website on this section. That's where to find the specific information for that plan provider. If you can enroll online, that'll be at the very top of the page. There's going to be an enroll button. Yeah, so there happens to be one here. Not all of the plans have an online enrollment option, so just be aware of that, but that's not a big deal. Then you can just call or contact the plan provider. Again, like Matt said, if you're perfectly happy with the plan that you have for 2020 and you just want to continue that same plan for 2021, you don't have to do anything. It'll auto renew. If you're not sure, you know, once you go through this exercise, if you're not sure, like, hey, I'm not sure if this is the best plan for me, or am I looking at the right information? Like, you can call us or email us and we can help you review this. There's a lot of information on this site, and generally speaking, Medicare can be really confusing. So don't feel embarrassed or bad about contacting us. We're more than happy to help if you need it. One last thing that I'll note is that on any of these pages, there's a print button option. And especially if you're going to call the plan provider to enroll, or you have questions that you want to ask that provider, feel free to print the details. And you don't even have to like print it on paper. You can just download the PDF of that page, but that way you have easy access to that information if you're trying to figure things out, or you just want to document that information for your records until you get the actual paperwork from the insurance company. So that's an easy thing to do. And then I think that covers what I wanted to make sure we hit.
Yep, great. Thank you. Thank you, Jesse, for those that have kind of gone through this process with us. I know you talked to Jesse, or at least seen some of the material that she puts together. I think there was a handout in the most recent newsletter, a real good, just kind of 2-pager on Medicare that Jesse put together. That's a real good overview of this also. A good thing just to have for yourself, or give to your family and your friends, as you know this time of the year is the time everyone's talking about it. And so Jesse's put together some great resources, kind of our our resident expert on this lately. And so, as she said, please feel free to call, email when you have questions. We're happy to talk to you about this.